We're here at the International Conference in South Africa, Cape Town, South Africa. We're here with Paula Akugizebwe, who is with the AIDS and Rights Alliance of Southern Africa. And I was so impressed with your presentation. Obviously, there was no mistake by your being on a panel here, and that you would be certainly a good spokesperson for a lot of the folks who need to be hearing messages. And that's the reason I brought you and hoped that you would do this interview with us. So tell us a little about the organization and what you actually do.
Right. ARASA, the AIDS and Rights Alliance for Southern Africa, is a regional partnership of civil society organizations who work on TB, HIV, and human rights. So it was established in 2002 when there was a meeting where it was recognized that in certain parts of the region there was a very strong base for advocacy, such as South Africa, well, only South Africa really, and then a couple of good organizations elsewhere, but all across the region there was a need to strengthen the capacity for groups to do advocacy on human rights and HIV, and there's also an interest from groups in doing that. So ARASA was formed initially to help facilitate those linkages, so you could have stronger groups like the TAC working with other smaller groups who are identified in other countries to help build up their capacity for advocacy, because that's the number one priority, is capacity building. So it's come a long way since then, and its vision has expanded quite a bit. Currently we have two main programs, one which looks more at the policies and laws around human rights and HIV, and then the program that I work on, which is the Treatment, Literacy and Advocacy Program. And our goal is to build the capacity of communities to do advocacy for a rights-based approach to TB and HIV treatment and prevention, which basically means that people, first of all, have the right to access high-quality prevention and treatment, but secondly, that those services should be provided in a way that doesn't violate the rights. So human rights protections are a big part of all the work that we do. So we work in 2 focus countries at a time, and then provide support to people when they raise issues across the region as well. But a lot of our focus is on 2 focus countries. We do financial and technical assistance to build up movements in countries. So it's long-term projects, training people in the science of TB, HIV, not necessarily imposing an advocacy agenda on community groups, but giving them the information that they need to analyze the health situation in the country and figure out for themselves what the gaps are that they need to be advocating on. Because our main principle is that knowledge is power. So as long as people don't have knowledge and they don't have understanding of policies and of the science, they're disempowered and they can't really make an argument for the rights-based approach to healthcare because they don't know the technicalities. So we give people that technical knowledge, and advocacy always evolves as a result. And then we also try to kickstart advocacy campaigns at the regional level on critical issues, like right now, for example, the financing issue. And last year we also did similar work on TB.
So the work that you're doing is really teaching the teachers, and do you work with other organizations? Like in the States, we have a lot of this going on. Do you collaborate with organizations about approaches and about what you're doing and ask for support? Is there some sort of collaborative effort going on, not only from the States, but maybe with Europeans as well, or other people in Africa? I mean, you're working within Southern Africa.
Yeah, definitely. I mean, our approach isn't to create, little ARASA branches across Southern Africa. So even in the projects that we work, where we invest a lot of our resources, it wouldn't be an ARASA program. We find organizations within the country that are interested in taking on advocacy for access to treatment, and then we build up the program within that organization so that it's sustainable, it's absorbed as part of the greater work of what that organization does. And we have collaborated with other groups in the past. We've done a couple, or facilitated a few trainings for the international community of women living with HIV, and with the Treatment Action Group as well, worked with them on some trainings. But really our ultimate goal is to build capacity locally and regionally, and to ensure that that's sustainable. Like you say, training, teaching the teachers, that's precisely the model that we use. We do training of trainers. So you train a small cadre of people who are then highly skilled and have that expert knowledge, and then go out and train more people. So it's sort of a domino effect. I don't know if that's the right phrase, but.
Do you find a way to either evaluate that and also, or as well to follow up to see how people are doing and let them measure their effectiveness and that sort of thing? Yeah.
Well, our projects are long term. So when we work in a country, it's usually for 2 to 3 years. So it's over a long period. And at the beginning, of course, the objectives are articulated. Usually for the first year of the project, the emphasis is on building up that knowledge base. So the first year, there's a lot of training that goes on at community level and at central level to get that knowledge in place. And then after that, we find that advocacy naturally results because people now have that understanding. They start looking around them and saying, well, you know, if we had some infection control in these clinics, then maybe we wouldn't have the TB problem that we have. And advocacy is always more difficult to evaluate because to feel the impact takes a much longer time. But we have noted successes definitely in campaigns that we have worked on. And I think it helps to have that long-term engagement with groups because then you can actually witness them evolve. I was actually volunteering in Botswana, which is where RASA first started working with the Botswana organization that RASA came to work with. That was how I first got exposed to RASA's work. And it's astounding, you know, having been a volunteer there and been in the room when we're all sitting around, you know, talking about treatment literacy and advocacy, and those were just words that didn't mean anything to us. And I volunteered with them for a while. I went elsewhere, you know, did some other work, and then came back to work for RASA a couple of years later, and returned to Botswana and visited the same group, and it was quite dumbfounding to see how far they had come.
So you're in your young 20s. And this is where your formative years, I would say. I mean, maybe you know, and it's at the point where you really do get potentially inspired by others and by peers. And so your peer groups that you set together, do they? I mean, you said we didn't kind of have that concept going on of what your empowerment could actually do. Is that a very typical of in this country and in Southern Africa? Yeah.
I think. Yeah. I mean, yes. I think it is. I can't really comment authoritatively on that, but at least from the circles that I've mingled with, you know, it seems that there's a certain degree of disillusionment and of not really knowing what one can do to help. You know, in the Southern African region, for example, we've had Zimbabwe, which was a crisis that was brewing for a very long time. A lot of people saw it coming. There was a lot of outcry, and it didn't really amount to anything because the systems of accountability in our region are really, really poor. And unfortunately, the impact that has on people my age is, you know, you look at the situation and you say, well, what can I really do to change anything? And I know a lot of my peers who think like that, but I also know a lot who don't think like that and who do have that long-term commitment to making things change gradually.